yeah, we'll just go ahead and fix that if we can. But if you got one of those long-time chronic dementias, and lots of times you never find out, is it the Alzheimer's dementia? Is it Pick's disease? Is it Lewy body? Is it Creutzfeldt-Jakob? Is it temporal? You never find out, so you're just gonna treat the person. This person is having problems with anxiety. This person is having troubles with whatever.
Mr. Wilhelm.
Has there been any kind of study to refresh your memories that are lost? Has there been any type of study? The example I am going to use is, I've had Parkinson's for quite a few years. And so I can't write. So I slip in, and if I want to do something, I type it. The other day I had a poem running through my mind. I thought, well, I'm just going to go in there and I've typed since I was 10 years old and I can't remember my keyboard. Do I get a book and redo the keyboard?
You know,
Or do I just let it go?
if there was a speech language pathologist up here, he or she could talk about this better than I can, although this might be something the docs know. They know a lot about
Was there a
brains.
study done on that?
A
Whether
lot of-
I go and get a book that teaches me how to type again.
It was popular up until, say, 2-3 years ago to say, oh, don't bother trying to teach people with dementia anything. They can't, and it'll frustrate them. And then speech language pathologists are really, really working on this and trying to say, can we teach people things? And I would say it's still at the research stage. It's not really at the stage that is brought to people's lives unless you happen to hang out with a speech language pathologist.
I learned to type when I was 10 years old. There was only one girl in the class that could type faster than I could.
I think what's clear is people with dementia will have trouble learning or relearning things, but can you have hope that it's possible? Yeah, I think research is playing around with that and trying to figure that out.
We have a
Maybe
question.
I should try it.
Maybe you should just try it. Open up that book and see what you can do. But if you get frustrated, by the way, frustration goes to a certain part of your brain called hippocampus, which is where your thinking is. And then now you can't think. So you want to avoid frustration. You want to do everything with a spirit of calmness. And you want to keep your hippocampus calm so you can think. So if you get frustrated, let it go.
Okay, the question in the second row.
Yes. Are there different, call it stages of Alzheimer's? Like the ones, there are some people that, like say your mother. Your mother doesn't know who you are. She doesn't know who her husband is. Doesn't know who her kids are anymore.
Alzheimer's is progressive,
I mean,
And
to
so-
that stage.
absolutely. And so when a person begins with Alzheimer's, it may be with some of the issues that were mentioned earlier. I got turned around going from point A to point B. And then it may progress to, we're having the same conversation that we just had about 5 minutes ago and the person doesn't remember it. And then it may progress to not recognizing close family members. And as it progresses further and further on,
That's the scary part.
and truthfully that is. That's why there are places that have special Alzheimer's units to try and take care of folks who are very, very advanced, because it's difficult oftentimes for family members to take care of it. Early on, it's okay, but as it progresses, it becomes very, very difficult. And that's why those units exist. It's usually hard for people to talk about it because they're like, I don't want to be there. I would never want to have to put my loved one there. But I will tell you that there's a reason why those places exist, and that's because they do a wonderful job of addressing those kind of behaviors, which are very, very difficult sometimes to manage.
I'd like to use this opportunity to bring us back to why you need to bring what you might think is a waste of a doctor's time to have the time to talk to the doctor, because if you wait and until the symptoms are so pronounced, would you discuss how the patient might have missed an opportunity to treat those symptoms had they shared them with you? Is there anything you can do to reinforce that message that our experience is that people who have concerns about their memory loss, they don't want to know. I'm going to get along for as long as I can until it's so obvious to my doctor that something's wrong, then we'll deal with it. Why is that a bad approach to take?
Your question might be a medical question, and I'll give it to them, but
Okay.
I'd like to address it from a social
Thank you.
social worker's perspective. Okay, so if Sue's question is, I should just ignore this until it's so bad I can't handle it anymore, is that a missed opportunity? From just an everyday life perspective, it's a missed opportunity. Because let's say your problems are things like you get easily upset. Well, if you got a diagnosis of Alzheimer's disease or another dementia, and a dementia that can't be fixed, the people around you could have learned how to help you deal with that. And so now you go through 3 years of getting upset all the time when all you needed was a social worker to help you figure this out. So for example, we have a program that we call RDAD, Reducing Disability in Alzheimer's Disease. We come to your house 18 times. It's absolutely free. It starts out kind of intense because it's twice a week for 3 weeks. Once a week, 4 more weeks. We really get to know you. We do gentle exercises, you know, the exercises seniors do, like lift your leg 6 times. But then we talk to the caregiver, the family member, about, so what are they having trouble with? And they might say things like, she won't take a shower. 3-4 weeks will go by and I can't get her to take a shower. And we teach the caregiver strategies for how do you get someone to take a shower? And then maybe the next problem is she's losing her temper all the time. Every time I open my mouth, she jumps down my throat. I remember I visited someone 6 times before I figured out what was going on there. And but you try to figure out the problems and work with it. It reduces suffering. It reduces disability. So if you get your diagnosis, you can start tackling it. One man, his problem was every time he'd go out for his newspaper, he'd forget to hit the toggle switch on the door. The door would lock him out, and he's locked out on the front stoop in his jammies. You know? So what are we going to do about it? We came up with strategies for him, you know? So by getting your diagnosis, you can start tackling how to live with it. One fellow wanted to know, okay, I've got this diagnosis, how do I keep going hunting? And the strategy was, don't go hunting by yourself. You might get lost. And you might need some guidance about what to shoot, you know? So if you got your diagnosis, you could start putting into place things like a power of attorney for healthcare. My power of attorney for business, I might need it someday. I could put into place things like conversations, like our family's never been good about talking about this kind of stuff. Well, let's help you figure out how you can talk about this kind of stuff. We have another program called SHARE where we talk with people in the early stage, setting up their plan of care for the future. Like, if someday you need help with driving you places, let's figure out how that's going to happen. If someday you need help and you need to move to a special care unit, how's that going to happen? And we can actually help you set up your care plan beforehand. So I think it's a missed opportunity to not get your diagnosis from just a living aspect. But your question was probably, is there a missed opportunity from a medical aspect? But I just jumped in there.
And that was great information, Cheryl. I'm really glad you interjected that. But yeah, in addition to that, quality of life. So first of all, if you're willing to acknowledge that something doesn't seem to be right, there's an opportunity to keep your quality of life high by addressing it early. Is there an opportunity for maintaining a higher level of health and medical stability by discussing it early?
Or you're taking medicines or something.
you know,
A lot of what we do in primary care medicine these days is prevention. You hear a lot of talk about preventive medicine. That's why you keep your blood pressure under control, even though you don't feel bad when it's up. That's why you keep your cholesterol under control, even though you don't feel bad. Because if you address these things, even though you're not feeling bad, you're preventing other things from down the road. So how does that factor into these considerations? Well, we know that Alzheimer's is out there, and we know that it can't be cured, and we know that it's progressive. But similar to as we were mentioning earlier, finding it early is a way to hopefully manage it optimally and minimize the issues from it for as long as possible. Most of you, I would hope, don't drive your cars around when the warning lights are on the dashboard. When your oil pressure light is flashing red, you say, I probably shouldn't keep driving. The car's running okay, but there's got to be some sort of a problem here. It would be foolish of me to keep driving. Hopefully you aren't driving with your oil pressure lights on. But if you identify a problem early, there's the opportunity to hopefully keep a problem from getting bigger faster. So if you can do it sooner is always better than later.
Okay, I got a question.
Go ahead.
You know,
Not about oil pressure though, because I don't know.
get out and check the oil. If no oil in the car, you quit driving. If no oil, you can get
Really?
home. Yeah, that's what you do. But anyway, don't worry about that. I went to, well, make a long story short, I went to Cleveland to get my buddy at the airport here a year or so ago, and on the way I got lost. Believe it, I called my wife and said, where am I at? I see downtown Cleveland. I'm going to the airport. Where's the airport? That really frustrated me. I was overwhelmed. But I got my senses and come back. But that's happened a couple other times since when I've gone someplace. But I stopped and get my thinking straight and I've been able to make it. But anyway, the doctor played that clock business with me, and the last time I was in the scene, because we talked about it, forgetting everything. And anyway, I think he thinks I'm all right. Now I'm wondering, am I all right? That's where I'm at. I'm wondering, am I all right?
Well, first of all, I want to applaud you for recognizing that was something that was worth talking to your doctor about. And I hope the audience learns from that example, because it's kind of like the zip code thing. So first of all, kudos to you for bringing that up to a physician and not thinking that that's a waste of his time or your time. So.
Where do you go with that?
Now what do we do? Yeah, right.
well, I think with, as we said, this is something that can be progressive. So if you have a warning sign like your gas light comes on, okay, well, it's a warning sign, so you want to make sure you watch, and if things are changing, then we can't say if you're all right now, but you want to make sure that you've obviously been concerned, had some issues come up that were enough to talk to your doctor. So then you want to, make sure that things aren't getting worse or happening more often. And if they are, revisit. Don't be afraid to go back to your doctor and say, I think that maybe you got it wrong the first time, or that something's changed. Not that necessarily that he got it wrong, but that something's changed. So.
Would either of you care to comment on a geriatric assessment where you have a geriatrician, a geriatric nurse, maybe a neurologist, where it's like a 3 or 4 hour assessment procedure? At what time do you start talking to your family doctor about, is that something that would be right for me? Do you bring?
That's a good question. When do you move from seeing your regular doctor, potentially seeing a specialist? There are geriatric specialists, there are geriatric assessment clinics that involve a lot of various specialty doctors that work together. That's not an easy answer. It's not an easy to say, well, if X, Y, and Z happens, then it's time. I think if there continue to be progressive problems, and despite the interventions that are being pursued, that things aren't improving, that's the time to always consider getting another opinion.
So in the example about he had a couple of episodes where he didn't get to where he was going until he stopped and thought about how to get there again. If that were to happen again, you bring it up to your primary care physician and say, is this worth me going to see somebody who's a specialist in this area and then the doctor refers, or how does that work?
I think we even need to assess that trip to the airport. Like, how often do you make it? Because a 30-year-old might have had the same experience if they weren't familiar with the trip. So I'd want to know more about that trip to the airport. Have you done it so many, many times and the roads have not changed?
I know where the airport is.
So that's why you were frustrated, is because this is something I should know, this is a change. And you might have, done that clock test perfectly. Let's say you are just perfectly healthy. You're just very, very healthy. But let's say you're not. The changes could be so mild that there isn't any assessment tool that could pick it up yet. So that's why you would go back again.
Well, I stopped though, and I thought for a minute when he gave me that paper and that clock idea, and I thought, oh, here. And then I was able to answer it, you know what I'm saying?
Mm-hmm.
But I couldn't have done that, because I know that. Of course, I don't know zip codes and phone numbers either, but I know where to find them to look them up, so I don't worry about it,
We're looking for change. So if you used to be really great at names and now you're not, which is my issue, that's frequently that so-called normal aging. But if it starts interfering with your life, then you go to the doctor and try to figure out, is there something going on with my thyroid or vitamins or whatever.
We can also get one of them cell phones that has GPS on. You just
I got GPS and I can't believe I'm gonna work. I got a home put in it, so I know how to get home.
So I guess I have a follow-up question about specialists. So if I do go to a neurologist, does that mean I've now abandoned my primary care physician? She's never going to see me again, and all I can do is see this neurologist every 3 years? That's kind of a leading question, what I'm getting at, huh?
When you go to see a specialist, you always still are following with your family doctor. The specialist is just that. They're a specialist in that one area, but you have more than just one area of your body. You have more than just your brain. You have your heart, your lungs, your kidneys. So you still go to your family doctor for all of that stuff. And you may go to specialists for those different things as well. You may go to lots of doctors, but the family doctor is the one that's going to kind of coordinate everything that's going on so that they can see the big picture, and they're getting all the information from the other doctors in one place, okay? Because the neurologist may not get the information from the heart doctor and the kidney doctor, but the family doctor should have all of that information. That's your medical home, so to speak.
Good, I'm on the right track there.
Okay, this gentleman.
I've taken care of rental property for 50 years, in excess of 150 apartments. Over the 50 years, I couldn't even estimate how many people I've come in contact with. And they come up to me and say, "Do you remember me?" How long ago was it? Well, 20 years ago, I lived over on Fulton Street. Oh, have you changed a little bit in 20 years? Probably. So and I say something to people like, well, my memory's not what it used to be, and they go, "Oh, yours is bad. You don't have mine." Everybody has a bad memory. Everybody has dementia.
I've been seeing patients in Sandusky for almost 20 years.
So you got the same problem she's got?
My wife will say to me after we're going in a store and someone walks by and says, "Hello, Dr. Mass," and I say, "Hi." We'll walk away and just say, "You haven't a clue who that was."
So,
I've been seeing patients for 2 years.
For me, it's a blessing though, because as a social worker, I'm supposed to keep confidential whether I even know this person. So I work for the Alzheimer's Association. Some people find Alzheimer's an embarrassing topic. So if I'm sitting in a restaurant and I see someone, I shouldn't say hi, because my partner will say, how do you know him? Well, I know him from the Alzheimer's Association. Oh, really? Well, luckily, my memory for faces and names is so bad that I don't recognize anybody, so I'm not in danger of hurting anybody's confidentiality. So it can be a blessing.
I wondered why you didn't say hi.
They call it, they actually, if I can get a little risque, maybe Sue should turn off the camera. They call it the hooker rule. I'm not supposed to recognize anybody until they recognize me.
Which one are you?
You understood what I was saying.
I just want to say, the other day I was in the store and I bumped into a gentleman, and the gentleman said, excuse me, which was quite natural. And I turned around and said, are you so-and-so? And he looked at me like, how do I know you? And then I introduced myself, and then, oh yeah. So I recognized him by his voice, not necessarily his face. And and I actually had his name and everything, where he didn't know my voice or face, only because I've changed since the last time I seen him 12 years ago.
This discussion is useful for two reasons around today that I can think of. One is to recognize and acknowledge that everybody has memory problems after about age 45, and by the time you're 70, you're saying, no, I'm not kidding, it's an actual problem. And you got all those uncomfortable little senior moments. So that's one thing that's good, is that we can recognize it's normal. The other thing I like about this discussion is, so let's say you do have a diagnosis of a chronic dementia that's just not going to be cured by, fixing your thyroid level. So you got dementia. When we have our early stage groups, and people are getting together and talking, it gives them a chance to relax and talk about it. So what do I do once I got the diagnosis of dementia? One thing you might want to do is hang out with other people who have dementia so you can share these kinds of stories and comfort. Because people with dementia will complain, they'll say things like, I told someone I lost my keys, and they say, oh, don't worry, I lose my keys all the time. And they're like, no, I'm telling you, this feels different. Or when we're at the art museum, one of our fellows is himself an artist. And he started talking about, ever since I got Alzheimer's disease, I'm so much more prolific. And I don't know, is it because the disease has changed my brain? Or is it because I have a sense of time running out? We don't get to have conversations like that among people who are going to go poo-poo. I don't want to talk about your dementia. That makes me uncomfortable. But if you're hanging out with other people who have dementia, you can talk about it and relax and feel like I'm normal. I just have another disease like people who have heart disease have heart disease. I got brain disease. So sharing that we all have memory problems, I think that's a useful thing.
And I also think another great thing about today is that we've all had the opportunity to laugh. And I think that that's healthy too. And when you get into groups like that, you can even laugh.
We have one program called MindWorks where we come together and do brain games. And it's called MindWorks. And I have never participated in it, but in my office all I hear are screams of laughter. And I think, there is no work going on in that.
We had a question up front.
Quick question. Does vertigo have anything to do with dementia?
Can you repeat the question?
The question was, does vertigo have anything to do with dementia? We talked that dementia is kind of a catch-all term for memory issues. Vertigo is a symptom. Vertigo is a symptom that usually deals with dizziness in your inner ear, not routinely. I'm not going to say that there's no conditions where vertigo and memory issues go together, but as a routine thing, those don't routinely go together. Again, if I would counsel that if you have specific concerns about memory plus vertigo, that's where you specifically want to talk to your doctor and they can drill into that. But as a general routine, I would say no.
Question. Shirley.
I wrote it down.
Can you take Aricept as a preventative?
She asked, can you take Aricept as a preventative? I have not seen it.
Or what about ginkgo
They tried it
biloba?
with college students to see if it would help with their exam scores, and it didn't help. It didn't change anything. But that's about statistics and research. So I'm uncomfortable saying no, it can't help at all. research, how's this? Research has not shown that it helps as a preventative.
And I would say it's not FDA approved as a preventative, so it would be, that wouldn't be a typical use for a physician to prescribe it.
But you are making me think. I did bring information about our trial match program. They're always looking for healthy volunteers to test out these kinds of questions. So there could well be a clinical study going on about Aricept as a preventative, especially I could see people signing up for it if it ran in their family and they were concerned. So we have a program called Trial Match, which they would match you with a clinical trial. Let's say you've got Alzheimer's and you want to try out different drugs, or you're a volunteer who's healthy. They can match you with studies that are going on that match your interests and concerns, and if location is a problem, your area. So I brought information about Trial Match. But that would be an interesting research question, wouldn't it?
Sharon?
I want to make a comment on vertigo, some of the problems that I have. I don't drive anymore. I let my sweetie do the driving. But I still feel healthy enough to get out, ride the lawnmower around, and I do real fine in the front lawn. But when I get out in the back, going under through the apple tree and going round and round, I get drunker than a skunk. I have to stop. I get so drunk I'm ready to fall off the tractor.
Sharon?
It's a cheap drunk, it sure is.
So just to repeat the comment, Gopi was saying that he had a story about vertigo that although he doesn't drive, he does use the tractor mower, and sometimes if the circles are too little, he gets a little dizzy.
Well, the flickering of going under that.
Oh, that's what it was.
That part of it.
The flickering of the trees. And,
Sharon?
Maybe an apple fell down and hit you on the head.
But I've also noticed that the flickering, like if we're driving, I'm riding along, you know, and the sunlight starts flickering. I'm like, that's
Okay, Sharon?
Is there anything on the horizon that is to treat or to prevent or any of the above getting dementia? If they don't know what causes it, they don't know how to treat it, and they don't know how to cure it, what's the point?
okay, so what's on the horizon? Several areas. One is more drugs like Aricept that don't actually cure, but treat elements of it, you know, the cells talking to each other. But they also, so if we're talking about the dementia called Alzheimer's disease, there's a protein called amyloid that collects in your brain, and they're looking at ways that they could get rid of the amyloid. So in the 90s, they actually found what they called a vaccine that was stripping amyloid out of the brain of rats. And when they tried it in humans, it caused swelling, so they stopped it. Now they're trying to reconfigure it. But a problem with taking amyloid out of the brain is, let's say this is a piece of brain tissue and I got some amyloid stuck in it. If you took it out, and there are drugs out there that can take it out, it's too late. You already have a hole, right? You already have damage. So now they're working on some drugs. Most of the stuff is about drugs. Drugs that could gobble up the amyloid before it ever got to your brain. So now they're learning that you need some amyloid, just like you hear you need some cholesterol. It turns out you need some amyloid. So how could they gobble up the amyloid in the right amount? So that's one direction, and they're pretty excited about that. That would be a genuine prevention, wouldn't it? That wouldn't be just the part that we can take care of, like exercising and eating right and doing crossword puzzles. This would be actual scientific prevention. But part of your question was, we don't even know what sets off this stuff. So they're studying more and more about the brain and what's happening to the brain with Alzheimer's. And they understand, so as this happens, maybe we could intervene here. As this happens, we could intervene here. But what started it all is still not understood. So you're right on target there. So the researchers used to be very doom and gloomy as recently as 5-7 years ago. Now you go to conferences and they're practically kicking their heels, they're so excited. They really feel like they could make a difference here. And if I could put in a pitch, my political pitch, we need money for this research. And here's the figures. When they started the campaign against heart disease, you know what? Just as many people have heart disease now because we're doing all the things we do to increase our risks, but the death rates from heart disease are going down, 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 down because they know how to treat it. You know what? They're spending $8 billion a year on research for heart disease, and look at the success they're having. Cancer. People are still getting cancer and you can't always cure it. But the death rates from cancer, okay, they're not going down like that, but they're going down. And they're spending $6 billion a year on cancer research. Do you remember when HIV/AIDS was an automatic death sentence? Death rates from HIV/AIDS down, $3 billion a year. $450 million on Alzheimer's disease. So this year, the government passed a National Alzheimer Plan Act, just like we have a National Cancer Plan, and a National Heart Disease Plan, and a National AIDS Plan. Now we have to fund it, because it was planned, the Alzheimer's Disease Plan Act was, NAPA they call it, was passed without money. So instead of spending $480 million a year, we want to spend $1 billion too. So we did advocate, and we're advocating for an additional $100 million to bring it up to $580 million, you know, at least $500 million. So you could be advocating for, let's get some research out about Alzheimer's, not because we're trying to take money away from heart and cancer, please don't, that runs in my family. But we want to duplicate their success and have our death rates go down. This is the only leading cause of death where the death rates have skyrocketed by like 60% in just the last, I don't want to make up the number, but not that many years. 60% increase in death rates from Alzheimer's disease as our population ages, because it's so hugely correlated to age. So research is exciting, but it has to have funding, or the young researchers don't go into it. They go and research something that they can get paid for researching, because they don't just, go to work every day and not get paid. So I think research is going to lick this thing through genuine prevention.
Let me make a point. So Sharon raised some very valid questions, and my hope is that when you leave here, you leave here having understood the value, despite that they don't know what causes it, despite that they don't know exactly how to treat it, and despite the fact that there is no cure. That does not mean it is not worth talking to your doctor about. And that's really the syndrome that I hope we can break, that this belief system that since we don't know how it's caused, we don't know how to treat it, and we don't know how to cure it, I'm not going to talk to my doctor about it. I hope that when you leave here today, you at least leave understanding that there is great value in talking to your doctor when you have concerns about your memory. Now, what would not be of great value to you is if your physician or healthcare provider replies, well, what do you expect? You're 75 years old. That is not a diagnosis, and that is not helpful to you, and that is not an acceptable answer to your problem. So if that happens, then maybe that's the trigger to get a second opinion. But age is not a disease, and I hope you all understand that. Nobody dies because you're 80. You don't die from a chronological age. You die from a physiological cause, but it's not your chronological age.
So you're reminding me of a joke. Mr. Jones went to see his doctor because his left knee was paining him. So, doctor, gotta help me. Left knee paining me terrible. And the doctor looks him over and says, I'm sorry, Mr. Jones, that's just age. And he says, well, how can that be? My right knee's just as old and it doesn't hurt at all. So there's something going on.
Okay, there's another question in the audience?
Can I just comment
Oh, yeah,
on?
please.
It is true that we don't know what causes Alzheimer's, and there isn't a cure for it, but there's a lot of diseases that we say that about. We don't know why people get high blood pressure sometimes. We know some of the risk factors, but some people who don't smoke and exercise regularly, they get high blood pressure. We can use medicine to make it better, but we can't cure it. But people go to see their doctor for blood pressure all the time. You could say the same thing about asthma. You could say the same thing about diabetes. Clearly there are things that make these problems worse, we know that. But we don't know what causes a whole host of things. But research has given us tools to improve the quality of life that people have with this. It used to be before insulin, if you were a kid and you got diabetes, you were going to die because there was no treatment for it. There's no cure for type 1 diabetes now, but there's a treatment for it, and type 1 diabetics lead long, long lives now. So things are coming down the pike in terms of how to help. I don't know that I can speak to what's on the cutting edge of it, but clearly issues like Alzheimer's, dementia are getting more and more attention because as a whole, over the last 50 years, the population in this country is getting older. A lot of times people 50 years ago didn't live long enough to get Alzheimer's. They died from their heart attack when they were 50 years old. Well, the things that killed people in their 50s and 60s are being better and better addressed. You don't hear about people dying from tuberculosis routinely anymore. People aren't dying from strep throat anymore. Again, we all say, well, that's easy stuff. We can fix that. We didn't used to be able to say that. But now people are living into their 70s and their 80s and their 90s regularly. And so the things that are common in 70 and 80 and 90-year-olds are now starting to get a lot of attention on how do we address these things and improve the quality of life at that stage of life.
Okay. And the person in the front row?
Cheryl, you kind of got me thinking about something that I read 15, 20 years ago, a long time ago, when Alzheimer's was first starting to be talked about even. And it made a lot of sense to me, and I don't hear anything about this anymore. But you think about our ages as we're progressing, and we all use this product, and more and more and more than we ever did. But I think it's, if there is any connections, it's hushed up with the big companies. And if there's aluminum, what is aluminum that we all, used to be, they talked about that, but you don't hear it anymore.
Okay, so his
We all
question,
suck on aluminum.
his question is, and specifically it was around 1988, 87, you heard a lot about aluminum being a causative of Alzheimer's disease, and there's concern because aluminum is like the most abundant mineral in the Earth's crust. We're breathing in aluminum this minute. I'm not going to utterly poo-poo it because there's some interesting stuff happening with chelation of all things that we always used to poo-poo. It came about because they used to do kidney dialysis with some product that left aluminum. I don't know if you know more. I can't speak any more specific than that. That left aluminum in your blood, and it somehow got past the blood-brain barrier, and these people all got dementia. Not Alzheimer's, but a dementia caused by aluminum. So everyone really jumped on that bandwagon in the 80s, and oddly enough started giving their aluminum pans to the Alzheimer's Association, like, thanks so much. And you've got aluminum in your most deodorants, or antiperspirants rather, and so people stopped using. And then they also, the inside of like soup cans, they put a plastic coat so you wouldn't get aluminum, although now they're saying this plastic coat is killing us. And so the aluminum was taken very seriously, and there are still studies going on with alum in Canadian water. But for the most part, they're saying, no, it looks like it's not aluminum because they've done so many brain autopsies and found no aluminum in the brains of these people with Alzheimer's. So they obviously didn't get it from the aluminum. I'm not ready to go poo-poo, it's not aluminum, because we still don't know what causes this stuff. And it's still not well understood. And as I said, in the past year or so, they are doing chelation for some heavy metals with oddly some positive results. Chelation is one of those things that I think is usually, it can cause, I don't think I'm competent to talk about chelation, but it's generally not considered mainstream.
Mr. Wilhelm.
Yeah, I take some of the medication for Alzheimer's, and I read everything. And I read all the different things about the medicine and their trials, all these programs they set up, whether some with placebo, and some with this, and some with that. And they were finding that they were using a B12 derivative as a partial carrier in this medication. And so they split that out. But they found that to the ones that it helped in their placebo, 20% of the people were helped with B12. And about 30% with their medication, but when the two was together, as in their pill, it worked even more effective. And in their describing of it, they even suggested that anybody over 50 ought to take a B12 vitamin, or at least they ought to have a study on whether B12 could prevent it. And this was all in their original writing.
Yeah, and I have an email address I can give you where you could get a Monday through Friday email telling you about latest research. I've been watching the B12 stuff too. The numbers are tiny. Here's the issue that Cookie's talking about. Okay, back to the brain cell. Now we're talking about this part of the brain cell, the axon. You have a fatty sheath coating it, and vitamin B12 helps to maintain that. And if you don't have enough B12, it starts stripping away and you have problems thinking. And then what I don't know is, by restoring B12, I don't know that you actually restore the brain cell. But anyway, you got to stop the loss of B12. But that's not what Cookie's saying. He's saying, so other people could take B12 because it obviously maintains brain health. So some of the research is saying there's no point in healthy people taking B12 if you have enough B12 in your blood. They actually have done research and say it doesn't seem to help people who have enough B12 to take more. And yet there are these other studies with smaller numbers coming out. So my only responses will be like, I don't know, we still need more study. And it wouldn't surprise me at all if there are clinical studies going on with B12, because that's one of those exciting things along with omega-3s, because it's cheap and it's things people can do and make you feel in control. And
Well, if it doesn't hurt you, why not take it?
you know, I'm outside my area of expertise if taking that particular vitamin can hurt you. Anyone know if taking that vitamin can hurt you?
Generally speaking, if you don't take massive amounts of B-complex vitamins, it won't cause harm. You bring up an interesting line of thought that you said, I was researching this and it sounds like maybe this is the answer, and then they did this and they found that some people got better and some people didn't.
Right.
We do something in the residency is where we train doctors for their various specialty. Dr. Flagar is finishing our residency program, and one of the things we do once a month is something called Journal Club, where we pull an article out of a medical journal, and we may look at something that's just been in the New England Journal of Medicine. And part of the reason that we do that is to really dissect it and say, was this a good study or not? We're asking the same kind of questions that you're asking. Maybe this has value. Maybe they just got lucky. Maybe they just picked some healthier people in that group, because you don't know. This is the challenge that comes out in medicine, not just with dementia, but in general. There are things that we believe at a given time are correct, and then in the future, as more studies are done, as more research is done, we learn that actually that wasn't correct. We actually were doing the wrong thing. There's an old line that is said that guy goes to his medical school and the professor on the first day of medical school stands up and says, What I'm about to tell you is going to bother you. 50% of the information that we're about to give you over the next few years of your training, we're going to find out is incorrect. The drawback is we don't know which is the 50% yet. But that's what happens all the time. There are lots of topics in medicine that are controversial because reasonable people try and figure out what's the best way to do this or what's the right treatment for that. And sometimes it's really fuzzy when they get the information back. A huge topic that's controversial is for women who go through menopause. Does taking hormones, is that beneficial or is it harmful? And boy, that's a huge topic right there, and people disagree on that. But you're asking a similar question. Is it the medicine? Maybe it was something that they gave that was a part of the medicine that wasn't even the active ingredient. These are hard things to solve, but they usually get figured out with time. And stuff that may seem really clear in time, if it's the truth, then it'll stay clear in the future. But if it's fuzzy, then people will revisit it down the road.
That's why they call practice medicine.
Right.
But yeah, I'd be glad to share that email address with you where you can get daily updates on research. It's fun.
Yes.
I'd like to share a cute story with you, a true story, that if we all did what my great-nephew told me one time. I used to babysit for him from the time he was a baby until he was about 10. And when he was 8 or 9, he said to me, "Do you remember the day we made pretzels?" And I said, "I really don't remember." I said, "With this computer brain I am, I don't remember." And he looked at me and he grinned and he said, "I think you better delete a few things, Aunt Kathy." I'll delete a few things we remember.
Well, oddly enough, your nephew was onto one of the theories why we have trouble with memory is that you have to go through too many bits of knowledge to access. That's one theory. It's not the only theory. And so he's saying you need to delete some of that information. That is a cute story.
Any other questions?
Now, what's going to happen when I get to be 95 and I'm still going strong like I am today?
We'll try to tolerate you, Larry.
Well, I made a deal with the doctor, haven't I told you? I died first, so he's going to be 99.
Did you hear his Dr. Matt's answer? He says you're going to drive him to the airport.
Any other questions? Yes, sir.
You bantered around short-term and long-term memories. What is short-term? What is long-term? I know that there's not going to be a black and white line, but relatively, you talked about any B vitamin is not going to hurt you if you don't take it in mega doses. What's a mega dose?
A whole bunch.
These are generalizations that are oftentimes thrown around. What's short term? What did you do this morning? What's long term? What did you do 20 years ago? I mean, those are some general categorizations. Where does the line between short term and long term shake out? I don't know. Probably differs depending on who you ask. But those are some general things.
Okay.
And we were going to have a neuropsychologist on the panel today who had a conflict in their schedule. There may be some specific definition to that. I just don't know it.
If you can remember stuff that happened years ago, that's long term. If you can't remember what you did yesterday, that's short term. That's the way I look at it.
And short term is what fails in age.
Yeah.
You just get less efficient. But the memories you put down years and years ago are with you unless disease robs you of them.
That leaves last week, last month, and the last 5 years.
So we,
And I'm not sure where to put
so
those.
yeah, we didn't answer your question about where is.
Well, and I don't expect an answer. I mean,
There may
it's
well be a need to
frustrating.
go. I bet you could Google it, and I think there's probably a definition.
She gave,
Larry.
she just says the memories you put down. In other words, you're saying if I decided I was going to remember it 20 years ago, I'd remember it today. Maybe I didn't decide to remember anything.
You didn't necessarily have to decide. Let's say you learned the word button. That was an actual connection, and now you got the word button the rest of your life. You know what button is. So you don't always decide what you're going to remember.
Well, I sure don't remember what I should remember.
Alice?
But that isn't, I can't say, but that's always true for definition, long-term, short-term. Because when you get dementia, you can't even remember your family that is 20 years old, you know.
It is sad, isn't it? Because disease can rob you even of your long-term memories. And it isn't just about memory. Alzheimer's robs you of your very functioning. So sometimes you even have trouble with movements. You can't even figure out how to sit down. Someone has to help you sit because you can't even remember how to sit. It's not remember. Your body doesn't. Your brain controls even your breathing. It controls your swallowing. As it goes on, it's not just memory. Your saliva might just run down in your lungs because you can't even swallow. So it's very sad that you lose these long-term things your body always used to be able to do. And now it's 3 o'clock, and I want to end on an uplifting point because dementia is very serious, very sad, but that doesn't mean it can't be treated. Just like asthma is very serious, diabetes type 1 is very serious, but we come up with treatments. The doctor can help you with things like, hopefully with things like anxiety and insomnia and such. The Alzheimer's Association can help you with some quality of life stuff, like how do I live with this thing? And I believe research is giving us hope, and society gives us hope. The way we're so much more accepting of people who have Alzheimer's. You can just come right out and tell someone you got Alzheimer's now, where you couldn't do that in the 90s. You really couldn't. It's entered the world of, this is one of those diseases people get. I don't know if you had anything to say.
I was gonna get I don't remember tattooed across my forehead. Would that help?
That could be one of our coping strategies.
Well, if I could, I'd like to thank the audience for being here today. I applaud you for your willingness to learn and understand, because only when we know better can we do better. And so I applaud you for being here this afternoon. Thanks to Cheryl for traveling from Toledo to be here and share her wisdom and knowledge with us. Dr. Mast and Dr. Flagar, thank you so much. It was a pleasure to have you all on our panel. Very helpful.